This conference will now be recorded.
Good afternoon, everyone, and welcome and thank you for attending today's Make Sense of HIPAA Risk Analysis webinar presented by HIPAAmate. HIPAAmate is a CalChiro benefit and an economical online software product that helps you effortlessly meet HIPAA compliance requirements. A few things before we begin today. Please make sure your phone and or computers are on mute at all times. In order to receive CE credit for today's webinar, you must be present for a minimum of 45 minutes. Please ensure that your name is in the attendee list, if you can, first and last name, or please chat your first and last name to us and we'll record it. CE certificates will be emailed to you after the presentation. There will be time for Q&A at the end, so please type your questions in the chat feature and they will be answered in order they are received. At this time, I would like to introduce the CEO of HIPAAmate and our presenter today, Dr. Jeff Brown.
Thank you so much. I'm glad to be here. Okay, so everybody, we are going to talk about HIPAA, which of course usually gets a lot of interesting responses from people when you mention the word HIPAA or HIPAA compliance. But I hope today that we're actually going to clear up a few things, make a little bit more sense of what all this, what this whole thing is all about by touching on the HIPAA risk analysis, which is one of the HIPAA safeguards, or I should say standards, that touches pretty much every other HIPAA requirement and or all the other HIPAA requirements feed into the risk analysis. So even though we're specifically talking about the risk analysis today, we are going to be mentioning a lot of things that are related to other compliance areas of HIPAA, just because the risk analysis is so all-encompassing. But to get going, that's a little bit about me. Click on my thing here to get going. There we go. So my name is Dr. Jeff Brown. I am a chiropractor. However, I don't practice anymore. I actually do this full time. Turns out I love HIPAA compliance. More so, I love building software to make HIPAA easy. But a little bit about me. I was in private practice back in 2004. I graduated school back in 2003. I opened a practice in 2004, right at the beginning of the year. And if any of you remember, back in that time, HIPAA, the HIPAA security rule had just come out, and we were just now under the thumb of that particular rule, which came out in 2003. We all needed to be compliant with the security rule by 2005. So HIPAA, if we back up a little further, started in 1996 with the privacy rule. That was a fairly benign rule. There wasn't a lot of teeth in it. It didn't require a ton of requirements from the provider. And in 2003, the security rule came out, which was far more complex because it had to do with electronic health information. Back in those days, of course, everyone started, or there was the beginning of the wave of people using a lot more electronic information. Computers were being integrated into practices far more. Hence, the security rule came out, which covers a lot of electronic information. It was then that I'm going to use this term, but understand that it actually is no longer this is true. But the burden of HIPAA was elevated significantly with the security rule. So in 2004, I go into practice. I need to be HIPAA compliant. So, because I knew that this was something I had to do. So I go and I did what most people do and actually continue to still do, which is I went to a colleague in town and I borrowed their HIPAA privacy policy. I said, hey, I need a manual, right? The HIPAA manual to be compliant. So I took their manual, I put my name and address on it, and I stuck it on a shelf. And I had a notice for privacy practices. That was pretty much it. Unfortunately, that's significantly under compliant, but that is actually the state of a lot of practices back then and even today. I think there's probably some of you on this call that are that same way. It's like, yeah, I pretty much have a binder and that's kind of it. You're going to see there's a little bit more to it than that. Anyway, so I practiced for 4 years. I then took a fork in the road and I started working for an electronic health records company, doing some consulting for medical necessity, et cetera. And it was during that time that the big EHR stimulus, the whole meaningful use thing came out, and they asked me, they said, hey, Jeff, you're a chiropractor. Do you think our users would want to use a certified electronic health record to get a big government stimulus check? And I said, after looking into the rule, I said, yes, I think they would. They said, great, make it happen. because your software had to be certified by the government. I was like, what? So that was my first role where I was thrown into software, meaning creating software that had to do something or meet some certain objectives and pass government tests. And I actually fell in love with it. So much so that I left that job and I became the director of product management for a telemedicine startup here in Columbus, Ohio. And I did that for 2 years. Again, working entirely in software and healthcare, dealing with all, really enjoying myself. However, telemedicine is not quite my cup of tea because I am a chiropractor, and telemedicine is just a more efficient way to prescribe medications. So that didn't quite sit well with me. After 2 years, I said, I need to leave. I'm going to go back into practice. So that's what I did. I opened up another practice. This was in 2015. And I quickly realized, well, I need to be HIPAA compliant. So I went out in the marketplace, I looked around and I said, oh my gosh, this is absurd. Now, by this time, I'd worked for 2 software companies. I knew way more about HIPAA because in these companies, we had to deal with it. And I'm like, oh my gosh, people are still learning HIPAA the same way they were when I left back in 2008. Meaning they're going to seminars, they're buying paper manuals, they're hiring consultants. None of this stuff works. None of it has worked, and it certainly isn't going to just all of a sudden start working. I came from a software background, and I knew software could fix the problem, so that's what I did. So that's a little bit about me and why I'm even in this game and doing this presentation. So let's get on to the bulk of the presentation, which is we are going to talk about the risk analysis in particular. It's a very all-encompassing requirement under HIPAA, and there is a lot of confusion, a different kind of confusion probably than what you're thinking, but there is an enormous distinction that we need to really work out, and I'm going to go through that here in the next couple of slides. But so we need to talk about the confusion within the risk analysis. What does the OCR say about all this? So the OCR is the Office of Civil Rights. So when you look at HIPAA compliance, you have HIPAA, which is the law, right? Then you have Health and Human Services, HHS. They're the ones who are tasked with implementing the law and providing all of the guidance to us. And then there's the OCR, the Office of Civil Rights. They're the HIPAA police. Their job is to enforce the law. So when you look at any kind of audits that happen, it all is the OCR. They're the ones who are going to do audits. They're the ones who are going to hand down penalties, decide if there should be criminal charges, et cetera. So we need to look at what the OCR says about this whole risk analysis thing. Then I'm going to show you what a risk assessment looks like. This is the whole thing. We're going to talk about a difference between a risk assessment and a risk analysis, because you need to know what a risk assessment is and why you want to stay away from one. So I'm going to show you what that looks like. Then we were going to get into the meat and potatoes, if you will, which is the actual risk analysis. What's in one of those things and how do you do one? We're going to touch on those. Okay, let's jump into this. I'm going to have to talk fast because these always go quick. Why the confusion? So here I'm going to get into some details here, and you need to just kind of stick with me. I'm hoping it'll come together kind of toward the end here, but we need to look at terms, okay? And I'm going to tell you that everything I'm about to tell you, I fell for this exact same story, and maybe I'll talk a little more about that. This is the definition of a risk analysis under HIPAA. It is where you are supposed to conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of EPHI held by your practice. Whew, that's a mouthful. What I want you to pay attention to is that this is a risk analysis, and it has this term assessment in it. Okay, it says conduct an accurate and thorough assessment, blah, 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 blah. The confusion starts when we start to look at other areas of HIPAA. In this case, here's the breach notification procedure. So there's 3 rules in HIPAA. There's the privacy rule. Remember that one came out first? Then there was the security rule, which is really more complex, and it contains the risk analysis. That particular standard is in the security rule. Then there's something called the breach notification rule. Now that rule only gets triggered or becomes relevant to you as an office if you actually have a breach, or not even have a breach, but if you have a security incident and you might have a breach, that's where this rule comes in. Anyway, there's a rule, and if you look in this rule too, over in the right-hand side here, they use that term assessment again. Now in this case, it says, if you think you might have a breach, right? Whether your laptop is stolen or you have a virus or a ransomware or something like that, one of the first thing that you need to do is you need to look at the probability that the protected health information was compromised by doing a risk assessment, okay? These are two different things. This is a standard that you have to do on an annual basis, a risk analysis, which is, again, this thorough assessment. This just says, hey, look, if you have a breach or a possible breach, you need to basically assess the situation and determine if there was actually information that was lost. So this word assessment could be interchanged with something else. They should have done that. They shouldn't have used the term assessment. Investigation or risk investigation, that would have been better. Now, the next part is where things get really bad, because HHS, they're supposed to be our friend, right? Remember, they're the ones who they implement the law and they provide all of the guidance to us for how to basically bring these HIPAA practices into our offices and basically comply with the rule. Everything comes from HHS. Rarely would you ever actually want to look at the HIPAA law to get an answer, because good luck. It's very, very general information. So we look at HHS. Now, several years back, actually quite a few years back, they gave us, oh, lucky them, they're so nice to us. They gave us this free to download HIPAA security risk assessment tool. Extremely poor use of terms, because they use the term assessment in here too. It's an assessment tool, security risk assessment tool. Everyone has probably heard of this thing. If you've ever downloaded it onto your machine and actually tried to use it, it's like a gigantic spreadsheet is what it creates. It's super annoying. Please don't do one of these things. Here's the problem though. Remember, word assessment, okay? What happened was people, like myself included, doctors, consultants, huge IT firms, we're talking big security firms that are out there charging thousands of dollars to health systems and individual doctors. They made this leap. They said, okay, there's this tool that the government's giving called a risk assessment tool. In the definition of a risk analysis, it says you're supposed to conduct a thorough assessment. They made this leap. They said a risk assessment tool must be the assessment that they're talking about in the definition. Therefore, the risk analysis must be this assessment tool. That's not correct. You're mixing terms. Remember, if you swap out the word assessment and say evaluation, right? Conduct an accurate and thorough evaluation of the potential risk, there wouldn't have been this mistake where people are making basically they're swapping this term in to mean something that it doesn't. Huge government problem. I'm going to use different terms. I made this slide this morning, proud of myself. Let's look at this in terms that make more sense to us, or that you're used to hearing, and then you're going to see the logic of why, or see why that logic that people were using to match those two terms don't make sense. Okay, so let's pretend HIPAA is actually an agency where it governs sandwich shops in the US. And they have this definition of what's called a HIPAA cheese sandwich. And it says, you have to put your favorite cheese in between two slices of bread with lots of butter, cook on a hot griddle until bread is a crisp golden brown and cheese has melted, all right? So we're looking at cheese. It's this HIPAA cheese sandwich. Then they come out with this fancy tool. Remember, they govern sandwich shops. And they say, hey, we have a new tool. It's the HIPAA butter sandwich making tool. And if you use this tool to make a butter sandwich, you are guaranteed to pass the toughest government taste test. So here's the problem, right? In this tool, they use the word butter. In the definition of a cheese sandwich is the word butter. So what's happening is people are going, oh, look, we have a butter sandwich making tool, and the word butter is in this definition. So therefore, by using this tool, we must be meeting the HIPAA cheese sandwich. And of course, we all know that that's absurd. That isn't actually how that works, right? That's not correct. But understand that it is the exact same thing that's happening with the risk assessment. Remember that tool? And the risk analysis. So these are two completely different things. And I'm really pounding this home, because when you look for help in the market, when you go to vendors, you go to the biggest consultants out there in our industry and elsewhere, you go look at software tools. HIPAAmate is not the only software out there. There's tons of them. When you look at their marketing, they're going to be saying that they do a risk assessment. That's not what you want. And they think They believe, I don't think that this is not on purpose, it's just a mistake. They believe that it's a risk analysis. Or worse, they say that they're doing a risk analysis. Like, hey, when you buy our service, we're gonna do a risk analysis. But I'm looking at their intro videos and their demo videos, and I'm seeing a risk assessment. That's not good. You guys need to understand the difference here. And I will hopefully tell you that by the end of this. Okay, so a risk assessment is what's called a HIPAA compliance gap analysis. It is not required under HIPAA, okay? A little thing keeps popping up. A risk analysis, on the other hand, is required by HIPAA. So let's focus on the risk analysis. I want you to forever and ever, after this little workshop, to remove the word assessment out of your brain. And if you ever see it in a marketing piece or a company saying they're going to do one, just don't listen. Tune them out, turn away, walk away. Risk analysis, this is the big daddy. But you need to also know that the risk analysis can be mistaken, or people can use the term risk analysis when they're actually doing a risk assessment. Okay, moving on. What does the OCR say? Why is this so important? So remember back in 2015, I went into practice. I knew the way HIPAA was being done just didn't work. It wasn't going to work for me, certainly, and I knew it just hadn't been working for anybody. So I decided to build a software. In this process, I actually went to, so we're talking 2015, it was about a year later in 2016 that I really started to say, okay, I'm going to do this. And I started, spending nights and weekends doing the research, getting all prepped. And then it was in early 2017, I went to an old colleague that I had from the telehealth company. He was the VP of software engineering. And I said, hey, Matt, I have this idea. I think it's going to be great. Why don't you help me? It'll just take a couple months. Because in my brain back then, I'm going to back up a slide. This is what I still thought, because I was like everybody else, okay? Because I saw the free risk assessment tool, and I was like, oh, that's really what we need to do to be an office to be HIPAA compliant, is do this tool. And I said, hey, Matt, all we need to do is make this tool better than what it is, because that's what all the other products are doing. And I said, we need to make it better and make it less expensive. And I said, it'll take 2 months. Well, then I started digging into the rules, because we actually had to make the software. And what I found out was, holy smokes, these two things are not the same thing. They're very different. So then I had to put the brakes on everything. And as we built the tool, it turned out to be more like, let's see, probably about 9 to 10 months to build this thing, because we had to do this correctly, the risk analysis. I was freaking out, though, because I'm one of the only vendors who was doing this correctly. And so I thought, there's always that little thing in the back of your head that's like, man, if I'm the only one doing this, am I doing it wrong? Even though all the research you've done points to you're doing the right thing, but if you're the only one doing it, you still have doubts. But then I was vindicated, thankfully, just last year. And so we launched HIPAAmate in February of 2018. So this was just a couple months later in April 2018. Thank goodness, HHS, and really the OCR, this newsletter is the Office of Civil Rights newsletter. They do a cybersecurity newsletter every month, and they pretty much highlight kind of a big thing that they're either working on or that just needs to be out there. And in April 2018, this was the newsletter, and I had this big sigh of relief, and I was like, oh my gosh, thank goodness I was interpreting the rules right and knew that this whole assessment analysis thing was wrong. So here's what they said. They created this newsletter, and the whole title is that it's the difference between a risk analysis versus a gap analysis. What's the difference? That's the title of this thing. And remember, a gap analysis is a risk assessment. I'm not going to show you other documents to kind of prove what that is or why I'm saying that, but just know, the OCR, the Office of Civil Rights, says a risk assessment is nothing more than a gap analysis, and a gap analysis is not a risk analysis. I know there's a lot of analyses and et cetera. Down at the bottom, in highlighted yellow, it says the purpose of this document is to explain the general differences between a risk analysis, under basically the security rule, and a gap analysis. Okay, so this was good news for me, because I knew that we were on the right track, we were doing the right thing, but it was bad news for all the people who are buying services, of course, or people who have done risk assessments when they think they're compliant and they're not. Let's go into a little more detail. Why did the OCR decide to finally write this article up and say, look, everybody, you're doing it wrong? Here's why. Because if we all, or some of us, remember or recall these things called phase 2 audits, HIPAA audits. Remember, HIPAA does not randomly audit. They don't randomly audit. Except back in 2016 and 17, they did do some random audits because they wanted to just get an idea, how are people doing? HIPAA's been around for 15 years. The security rule's been around since 2005. So at this point, it had been 10 years. Like, well, geez, we should probably check to see how people are doing. So they did a random audit, fairly small sampling, but still an audit. And here's what they found. 0% of covered entities, CE is covered entity, that's you, 0% were in compliance with the risk analysis. This chart here is looking at strictly the risk analysis, but remember the risk analysis encompasses a whole bunch of other HIPAA standards. So they found 0% were in compliance and 14% substantially met the criteria. 0%. So I say this and I show this because I want you to know that you're not alone. Most people are not in compliance. You're not like left in the dark somewhere like, oh my gosh, where have I been? It's like, no. Most people are struggling with this thing. They're not in compliance, whether it's because they're just choosing to ignore things or they're just kind of following the wrong leader, if you will, or whatever it may be. They made an effort in a risk assessment, but they did the wrong thing. But what this then tells us, of course, is that 86% of providers out there, this is across all disciplines, not just chiropractic, but 86% minimally addressed requirements, negligible efforts, or did not provide any serious attempt to comply at all. So those are big numbers. Big numbers, right? 86% of the healthcare in general is not meeting the HIPAA rule, the biggest HIPAA rule, which is the, the HIPAA standard, which is the risk analysis. All right. The reason they're doing this is part of the whole that cybersecurity newsletter that came out. The reason they did is because they go, oh my gosh, we have these horrible stats. Doctors are not getting, they don't understand the risk analysis. And what they discovered was that if A, you didn't do anything, then you didn't do anything, right? Those lower percentages. If I go back, oh, sorry, now I got to hit my little buttons again. If I go back to these numbers right here, right? The 21%, maybe even the 33%, they just didn't do anything. But the people who are in this 32% and 14%, the reason they didn't get to that higher bar, in this case, what they did is they actually made an attempt to do a risk analysis, but they didn't actually do one. And what they discovered was it's because they're doing a risk assessment instead, all right? And remember, and this is partly in this newsletter too, is that a lot of these providers and big health groups, they're relying on expensive consulting firms that are their security people to do these they're doing risk assessments, and they think they're doing a risk analysis, and they weren't, and they're failing these audits. I'm going to escape out of the PowerPoint for a moment because I want to actually show you what, if I can, what a risk assessment looks like, so that you just know what they look like. Okay, so that's just the free tool online. It's a download. You can't download it on a Mac. It has to be downloaded only on a PC. Corey, come on, open up. This one, however, what I did is you can download sort of a Word version of it. So that's what I did. I downloaded the Word version. It has 3 sections: the administrative safeguards, the technical safeguards, and the can't think of the other one. Okay, so here's what a risk assessment is. It is a whole bunch. In fact, it's about 130 some questions. Okay, they're yes/no questions. So I'm going to zoom in on this because I know this is probably a little small. Let's just separate this out. There's lots and lots of questions like this. Let's take that away. Okay, where it says, does your practice develop and document and implement policies and procedures to manage and assess risk, right? Yes or no? That's kind of a broad statement. If I were you, I'd be like, what does that mean, right? So this, you enter yes, no, right? Let's go to another one. Sorry, these are all the definite. Here's another one. Does your practice have a process to periodically review, here's risk analysis, policies and procedures, and to make updates? Yes or no? Let's just skip way down. So there's a whole series. Remember, 130 some of these questions. Here's another one. Does your practice have a policy and procedure that makes sure those who have access to EPHI have access and those who don't are denied, yes or no. And then, by the way, some of these questions, if you answer no, let me just go up here to that first one. There's these. Okay, you have to say, great, yes or no. If you don't do it, why not? Oh, because it's cost, practice size, the complexity, alternative solution. Remember this. I'm going to talk about this in a little bit. So they ask you a question, yes or no. And if you put no, you're supposed to then check a little bubble here that says, well, why didn't you do it? And then give details. Okay, and then you have to have this priority or these vulnerabilities. Okay, yes, no questions. Now let me ask you something, Doc, or office manager, whoever's listening. If you answer yes to this question, great, you're awesome. But guess what that means? Somewhere you have to have this actually done in your office, correct? If you answer no, what does that mean? That means you still have to do it, right? It's a HIPAA standard. You still have to do this. So by answering no, you're telling yourself I don't have it, but it doesn't actually get you any closer to being HIPAA compliant because you're not actually doing the standard. You're answering yes, no questions. All the no's you still have to do. All the yeses you still have to do. So this risk assessment, remember, it's a bunch of yes, no questions. At the end of it, you get a pretty little spreadsheet. If anyone has ever done one of these or have had one done for them, you're going to get a spreadsheet that has red, yellows, and green colors and different numbers in there to say, oh, look, here's where you have all this risk. This is a risk assessment. It is not a risk analysis. Okay, let me jump back into the slides. And by the way, you have to be careful of these risk assessments. Remember, well, I just said it's a waste of time because you're answering yes, no to stuff. But whether you answer yes or you answer no, that activity did absolutely nothing to get you actually HIPAA compliant because you haven't done anything. You still have to do all of those activities. So we're going to jump into what is a risk analysis. But the risk assessment, sorry, one last little point on this, and then I'll leave it alone for a while. It's a waste of time, right? Just because there's a free tool out there doesn't mean you should use it. I would suggest, and I actually highly, highly recommend that you only ever do a risk assessment or hire someone to do a risk assessment if you have absolutely every single intent in your bone, in your body, to follow through on the assessment. Meaning when you see all the yeses and no, or really the no's, when you see no's, that you, within a reasonable amount of time, are going to act on those no's, do something about it, or thoroughly document why you're not doing it. And the reason why I say that is if you don't act on it, if you do a risk analysis, or sorry, if you do a risk assessment willy-nilly and you put it on a shelf somewhere and you don't do anything about it for the next year, and you have something bad happens, right? Somebody complains about your office and then you're in a HIPAA audit, or you just get, I don't know, audited for some reason. And you have evidence that you did a risk assessment and you never followed up on it. That is proof that you knew you were doing it wrong or that you weren't doing something right and you chose not to correct it. That's not good. That's called self-incrimination, and don't do it. In fact, some attorneys out there state only do a risk assessment if it is your attorney conducting the assessment, because then there's client-attorney privileges. So just be aware, this thing is bad news, people. It really is, unless you are seriously going to make make every attempt to follow through on the findings. Okay, let's jump into the risk assessment. Risk analysis, sorry, even I get messed up. Okay, here we go. The risk analysis is part of a security standard under the security rule called the Security Management Standard. Voila, it has two parts. There's the risk analysis and there's the risk management. I like to call that more the risk management plan because it's more of a plan. Okay, so the risk analysis, let's jump into that. What is it? Now, I already showed you this definition early on, right? It's where you conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, blah, 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 basically your information in your office. Okay, that's what it is. How do you do one? Or what are the pieces, or the pieces of it? Let me do a time check. Ooh, I'm doing okay. All right, a risk analysis. It starts with I'm going to back up slightly. There's a little bit of flexibility in how you conduct one of these things. One of the things that is a very big element of HIPAA in general is that HIPAA allows flexibility. It gives you, there's very little black and white. There are some black and white things, but for the most part, there's broad standards, and then you as an office gets to decide how you want to implement those standards to some degree. So there's some wiggle room in what I'm about to tell you as far as a risk analysis. However, what I'm going to show you is the Health and Human Services recommendation for doing a risk analysis. Even though what I'm saying is you can have a little bit of gray area and you can have some wiggle room, but this is kind of, we'll say, the gold standard for it. Okay, the first thing you want to do is review your workforce, your list of workforce, and your business associates. Now, this touches on a point I made earlier, which is where the risk analysis, remember, it feeds off of other HIPAA standards and requirements. In this case, you may not be aware of this, HIPAA requires that you have a list of your workforce in your office, meaning who are the people, who are they, what is their role in your office? Oh, it's the front desk person, or it's the provider, or it's the biller. What is their level of access to your information? Oh, they have all access, or no, they're only limited to scheduling information. You need to know what training they've had and they haven't had. You need to know what access devices those people have. Oh, Sally has a front door key, Jim has a swipe card, and whatever. These are other requirements under HIPAA. So when I say, oh, list your workforce, it's not just list them and that's it. There's some other things that you need to know about them, which makes sense. That's a whole nother webinar. Kaylee, maybe we should do that. Then you want to look at your business associates. So like your EHR vendors, your billing companies, if you use them, et cetera, email vendors, things like that. The reason these are part of this discussion is because, remember, if I back up a slide, it says you're conducting an accurate and thorough assessment. I'm going to use the term evaluation, right? You're conducting an accurate and thorough evaluation of the potential risks and vulnerabilities to your information, okay? So when we go back to here, do you think these two entities there's risks and vulnerabilities to your information because these are entities or people that have access to your information? So do you think that's a good idea to have involved in your risk analysis? Of course it is. That's why it's here. Because HIPAA says, look, you're doing a risk analysis. That starts with knowing the individuals or companies that have access to your stuff. That's what you start with. But it's not just a name. Again, there's a little bit more behind this one as far as what you need to know. Okay, number two. And again, I will show you in a moment here an actual risk analysis, like a finished one, so that you can kind of get a sense of what I'm saying. Okay. Step two is that they call it scope, right? But the best way to translate that is, what is your inventory of your EPHI? So your electronic information, right? And this the simplest way to think of this one is, it translates to, what is all the equipment in your office where patient information, electronic equipment, E, right, that's the E is, patient information, where patient information is either stored or it moves through, right? So maybe you have a server computer, it'd be stored on there, or thumb drives or something like that. Or when I was in practice, I didn't have an x-ray machine, so I would send people out to an imaging center for MRIs and sometimes x-rays, and then I would get discs back, right? So there's EPHI on those discs, and so I had to inventory the discs because that's information that's stored. Okay, so if I chose to keep those discs, that's not my responsibility to do so. That's a different story. All right, so let's go on. So this is inventory. This is, what are all the devices? Sorry. So I have a laptop in my office. I have a server computer, or I have a front desk has, there's two desktops up there. I have a cell phone that I use to check my schedule on, whatever. This is the list of your stuff that has access to your information. That should be a part of a risk analysis. Now, each one of these individual items, again, Kaylee, we may want to do another webinar. There's certain pieces of information. There's a different security rule, standard that talks about your inventory and the different things that you should know about each inventory item. For example, does it have encryption on it? Is it being backed up? Does it have a password protection? That kind of stuff. That makes sense. And I will show this to you again here in a little bit on the actual report. The next step is you then go through not through your office, but you sort of virtually take a step back from your office, and you have to look at the different threat vulnerability combinations that are basically threats to your office. This is the big distinction between this and like a risk assessment. Remember, an assessment is a whole bunch of yes/no stuff. If you don't ever see in the activity that somebody's having you do where you're actually looking at different threats, like real threats to your office, and looking at real vulnerabilities and creating what are called combinations, threat vulnerability combinations, then you're not doing an analysis. But the idea here is that you get each threat that is quote unquote reasonably anticipated. You only look at threats that you reasonably anticipate. So I'm in Ohio. I do not reasonably anticipate an earthquake. Therefore, any chiropractor or anybody in Ohio should not be assessing that threat. But maybe in California, sure, that's probably a reasonable, you reasonably anticipate one of those happening. So HIPAA does not want you to look at everything under the sun. They only want you to look at things that affect your practice. Another one might be open treatment, right? Eavesdropping. Eavesdropping is the threat, meaning patients hearing other patient conversations. Now, if you're in one office that has closed treatment rooms, guess what? That's not even a threat you should be worried about. But maybe you have an open adjusting concept or an open therapy bay, then that would be a threat, right? Is eavesdropping that is one that office would want to look at. Okay, and the vulnerability would just be that you have so the threat is eavesdropping. The vulnerability in that case is I have an open treatment concept. That's the threat vulnerability, okay? Or, earthquake, and it's just because I happen to live in an area where there's earthquakes. Maybe another one is this can happen quite often where you have the threat of theft or vandalism or something like that. And the vulnerability is you have a past workforce member that was like, it was like a hostile termination, meaning that's the term that HIPAA uses. It means that somebody left the office and it was not under good terms at all, and you have a concern that that person may try to do something to your practice to do something, right? So that is a threat vulnerability, a real threat vulnerability combination that you'd have to look at. All right, moving on. So after you create a list of threat vulnerability combinations, then what you do is you determine risk. Now, risk is a very simple equation. It is, what is the likelihood that the threat is going to be like exploited by the vulnerability, essentially, and then multiply by the impact. So let's give an example. What was one that I just thought of? Anyway, we'll look at, how about this? Likelihood of a theft, okay? Maybe your threat is theft, and the vulnerability is your office is located in a moderate or like a high crime area, right? Break-ins happen in your area on a somewhat frequent basis. So therefore, it's a reasonable threat. And so you're assessing risk of the threat of theft, and the vulnerability is your high crime or moderate crime area. So you go likelihood times impact. Let's say the likelihood you determine, this is a 1 to 5 scale. You can determine your own scale. It can be 1 to 3, 1 to 5, 1 to 10, 20, doesn't matter, but they do want you to have some sort of a benchmark of a multiplication factor. So let's go on the 5, that's just what we use. Let's say you go, you know what, this happens it could happen once a year. Or we would anticipate a break-in, well, let's just say once every 3 years. So you're gonna, and if you were using our product, you'd select a 3, right? About once every 3 years is the likelihood of it happening. If it were to happen, that depends. It depends on a lot, right? It could be, well, you know what? We lock up all of our laptops in a vault, like this impenetrable vault. So therefore, even if the office has a break-in, where there's not a lot of stuff they can steal or something like that. Or maybe you say, we use I don't know, or it is a huge impact. Right? If they steal our one server computer, we are totally shut down, out of business until we get a new server and get all of our stuff backed up. So that'd be a huge impact. That'd be like a 5. And then you multiply it, so you have a 3 times a 5, it'd be a 15. Then that gives us information about how we want to address it. Or maybe say, you know what, the impact isn't that big of a deal. So it's just a 1. What was it? Gosh, I had an example the other day about one of these, let's just, we'll move on with this one. So there's likelihood, impact. Now, the only way to look at likelihood and impact, there's information that you need to know before you don't just willy-nilly make up this decision, or the HIPAA doesn't want you to do that. I'm just gonna ballpark it and I'm gonna make a guess, right? you have to actually use a little bit of information and insight into your office to make this decision. So remember step 1 and 2 up here? These pieces of information, there's a little more to it in this stuff that helps you to drive this question. So let's look at theft. Okay, let's assume, actually we're not gonna assume, this is me, right? When I was in practice the second time, it was just me. I had no staff. I had a cell phone. I had the laptop I'm using right now. I had a printer at home. That was and an internet router. That was pretty much my equipment. That was it. I mean, there was 2 routers, I guess, one at the office and one at home. So I took my laptop home all the time. So let's say I go to the grocery store and I have to go grab something in the store, and I leave my laptop in the car. It's underneath my coat. It's in the car, right? But there is a threat of theft because my laptop is always leaving the office and it's being home with me, etc. And the vulnerability is, I don't know, moderate crime area. Okay, so for me to determine likelihood, I'd say, okay, well, what's the likelihood of it happening? And again, that one is a little bit more general as far as, well, it could happen this often. The impact, though, how bad is it if it were to happen? That's the impact. I have to know what the safeguards are on my laptop. Because if my laptop, for example, does not have password protection, the impact gets really bad. Why does that? Because if anyone takes my laptop and they open it up and turn it on, they have access to my stuff, right? That means there's a breach. If there's a breach, I have to report it to the feds. That's not cool. And the patients. If, however, my laptop did have password protection, then that lowers my impact, right? Because like, okay, good, there's a chance they can't get into my software. Then your next thing is, oh, well, wait, was automatic log off turned on? Because I could have my password protected, or I'm sorry, I could have my password protection, but if I don't have automatic log off turned on, then they could still open my laptop and it could be running, which is bad. So I have to look at that information. Then it might be, okay, let's say I have password protection, it automatically logs off. The next question is, did I have the hard drive encrypted? Because if I have encryption on it, then therefore there can never be a breach, or not never, but there's no breach. You don't have to report a breach. So that means the likelihood, sure, it could get stolen. I come out to my car, my laptop is gone, but because I know I have all those protections on it and it's encrypted, there is no breach, so my impact becomes lower. My impact is really just, oh crap, I have to go buy a new computer. That stinks. It's a money impact and a time, right? I got to go to the store and get a new one and maybe back up my stuff. So that's the impact. But do you see the difference between impact if you have an encrypted laptop versus non-encrypted can be very, very different. So that's why we need to know this information. By the way, encryption is not required by HIPAA. It's a good idea, but it is not required. Okay, moving on, you then have this report. So I'm going to show you that. So you have to report you have to have a risk analysis report. These are done at least once a year or annually. I'm going to escape, minimize this. I printed one of these off just a little bit ago. Here's a sample report. Let's see if I can zoom in a little bit for you. Well, it's going to make it messy. Okay. Blah, blah, there's just mumbo jumbo up front. But you have to remember the review of workforce. So you want to list your workforce, right? Who are they? What kind of access do they have? If you've had anybody who's been removed, in this case, there's a guy named Jeff. That's me. I had a role. I left a while ago, but the separation was amicable. Business associates, who are they? Do you have a business associate agreement on file? Like this, no, that increases. Remember the impact? That's information that helps me determine that. Here's the scope, right? Here's my stuff that I have in my office. Now, what you don't see in a report, because it doesn't need to be actually on the report, are all the safeguards that are in here. That's on a different list. But here's what I'm incorporating as part of, or what I'm looking at as part of this particular analysis is this equipment. Potential threats and vulnerabilities, you need to list them, right? Remember, these are called threat vulnerability combinations. So in this case, I'll zoom in a little. I created there's this broke up into natural, environmental, and human threats. Here's a wildfire, because I'm in a location prone to that. Power failures, because I have a building that has an unreliable power source, perhaps. Here's the eavesdropping one, right? Open treatment. Maybe another one is human error. That's common. Human threats are your most likely ones. You have more of those, but human error, we just tend to, we have a big staff and it seems like every year somebody's losing an office key, right? That is a threat. Human error, the vulnerability is you lose keys. There's things that matter with that, right? It increases the chance of somebody breaking into your office or having access to stuff. So there's things you want to do to mitigate that. So here, remember I said that to make decisions on these, you have to know what, in this case, we're going to call them security measures, you have in place to protect against those threat vulnerability combinations. I'm saying a lot of stuff right now, and you guys are probably starting to freak out like you always do when you go to HIPAA seminars. Please try not to let that happen because there are tools that make this like a breeze, like seriously. Anyway, so in a report, you want to list all the things that you do in your office, right? Like backing up stuff. Here I back things up. I back up my desktop computer, the reception one, and my laptop, number one, right? I have surge protection in place. I have a sanction policy, blah, 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 blah. Here's your likelihood scores. You have your impact scores. You have your risk levels. And the last part of the report is where you have the security measures that you don't currently have implemented, but that you could, okay? So for example, here's backup. Oh, look, I have a desktop computer that's not being backed up, okay? Or my phone, I don't back that up. All right, that's okay. I mean, you don't, well, you should. But this comes into the next piece. Okay, so I'm gonna jump off of this because I wanna try to wrap up. So this is the last part of the report, which is saying, hey, here's some things that I don't have in my office that could be helpful if I did. It would improve my security just environment. And then you have a signature. All right, jump back in, oops, jump back into here. Okay. So the next part then, oops, is the risk analysis report. I just showed that to you. It has all these points, right? The scope, et cetera, the scales, I just showed that to you. Zip, zip, zip. The second part, and then we took a look. Okay, here's the big problem with that. Remember I said you guys are probably freaking out because you were looking at all that going, holy smokes, how am I gonna do all that? Here's the problem, it has always been the problem, it's time. Trying to do that on your own, it's absurd. In fact, the OCR, remember them? Part of this 2018 cybersecurity newsletter, they said in there, they said, if you do a legitimate risk analysis, this should take you 20 hours. Who wants to do that? Do you think there's any wonder why chiropractors are not doing these things and they avoid them like the plague? 20 hours, we don't have that much time. I mean, oh my gosh, you gotta get your billing done, you gotta get your recalls done, all that stuff. And that's why this, which is the traditional way of doing HIPAA, it doesn't work. It never has worked, and it won't start working. This is actually the HIPAA security, or sorry, this is the HIPAA program at my chiropractor's office. She actually made an attempt to do HIPAA, and they were one of our first beta testers. And this is her actual stack of HIPAA, and so we're replacing that. It's fabulous. But anyway, software is the solution. This is not a sales pitch. I'm saying to find some software because 20 hours is not acceptable. Software can streamline that. So the second part of risk management is this risk management plan. Okay, now this is a detailed plan where you're basically going to implement security measures, safeguards to reduce risk to a reasonable level. Now the good news is, docs, we're almost done. This is the last slide. Well, there's one more. The good news is that for the most part, the government is not going to tell you what you have to do. With some exception, if there is a requirement, or sorry, a safeguard that is required, then yeah, you're going to have to do it, and there's a good reason for it. And as you're going to find out, the ones that are required are totally reasonable, and you would expect them to be required. But for example, like encryption, it's not required, but backup is. You want to make sure you have a backup of your data. You don't have to have like 30 backups and have actually everything be. We do have everything backed up, but if you have 13 computers that all access the same database, it's the one database that needs to be backed up, not the 13 computers. So data backup is required. So that one is one that you don't want to let that one slide, but other ones are not required. For example, like employee background checks. You don't have to do those. It's a recommendation, but not required. Okay, so a risk management plan, it starts with, remember that list at the end of the risk analysis, the red ones that said, here's all the things that you could do in your office that you don't do? That's what it starts with. Okay, you have the looks of the things that are not implemented, and then you decide on each one, say, hey, do I want to do it or not? The encryption of my laptop. I may go, you know what? I don't have my laptop encrypted, but geez, now they think about it, there is a pretty significant risk because if it gets stolen, I have to report a breach, and I don't want to do that. So you know what? I'm going to turn on encryption. If you have a Mac, it's simple. You turn it on, it's done. for the most part. If you have a PC, it's called BitLocker. You can use BitLocker. That's the encryption software on Windows machines. But anyway, just turn it on. Be done with it. Or you might say, you know what? No, we're not in. I really don't have. Or even if I reasonably anticipate a theft, it's not a high enough risk for me to worry about it. So I'm just not going to do it, and that's okay. You just have to document why not. Okay, when this says why or why not, there's 4 main reasons why you don't have to do something that's not required. I should anyway. So just know that there are a couple reasons. Cost is one of them. Security cameras. Let's look at that. Right, that is one of the HIPAA possibilities. Right, you could have security cameras on the entrance of your building or in your parking lot. If you're really worried about theft in your office, and that's going to be a deterrent to help reduce it, then you as an office in that office might go, you know what, that's something we're going to do. Another office might go, oh, I'm not going to add security cameras. I don't have the money to do that, and it's totally wouldn't really help out anyway. So you don't do it. You just say, nope, we're not going to do it because it costs too much, or it's not a feasible fix for the problem, which is totally fine. Okay. After you have your yeses and nos, what you've done is you've created a plan. You take all of the yeses and you create a plan, which is when do we want to have it done by, who's responsible for it, done. And then you work your plan. That literally, not that that's literally it, but that is it for the risk analysis. And now I know, yeah, we have a few minutes to talk, answer questions, but just understand that there was a lot there, but please, people, do not look at the way HIPAA has been done in the past. There's a reason we hate it. We hate HIPAA because we can't wrap our heads around it because there's so much going on and it's this huge, massive mess of stuff. But please understand that software, it untangles everything and it streamlines and it gives you like this option now where it's not a headache, where it's just this thing that you do, spend a few hours here and there. It doesn't take that long actually. And be done with it. Move on with your life. Make money. You need to see patients. That's where your focus needs to be. But you need to be compliant. So that's how I'll end it. Okay, so if there are any questions, Kaylee, we can have people ask, and if not, this has been fun. Probably more so for me than for you.
We do have a question. Dr. Brian Sensler asks, my office software, cloud storage, Dropbox, intake forms, and text/phone service are all cloud-based, HIPAA compliant, and have signed BAAs with me. Does that limit my risk considerably? And do I still need to back up if no information is stored on my computers locally?
So if part of their service is the backup, okay, so what that's kind of saying is that they are your backup and it's written in your terms of service with them, that's part of the service that you're paying them for is backup, then you're good to go. Just like any other doctor who's using any cloud-based EHR, that is typically what you're paying for every month is the service itself, but part of it is also the backup of the data. So in that case, you are good from a HIPAA standpoint. You are backing up your data, period, end of story. So that if anything bad happens, maybe there's someone locks your computer with ransomware, that doesn't mean you have a breach, people. Please don't listen to some of the scare tactics out there. No one wants to have a ransomware attack, but understand it doesn't automatically mean you have a breach. It just means your computers are locked down, or your data is locked down. You could have a breach, and that's where an IT guy has to come in, or gal. But if you have a ransomware, for example, you're completely locked out of your data, guess what you do? If you have a backup, this is the entire reason why there's a backup. It's not just ransomware, but maybe a tornado rips through your office and you need to back up all your data. The whole point is that you can just buy a new machine or completely rewrite the software on the machine and reinstall your operating system. And guess what? You go to your backup, you bring your backup back in, and you're off to the races. And you don't have to pay a ransom or any of that kind of stuff. So that's why backup is so important. Is there any other questions?
I'm not seeing any questions at this time. So
you mean I explained it so well?
One just came through from Dr. Campbell. What does your service charge for various levels of compliance?
Oh, okay. Am I allowed to? I guess we're after the 45 minutes, right?
Yes.
Okay. The best way to do that is just to show you, because it's just easier. Dr. Campbell, I think you said?
Correct.
Okay. So let's jump over to our website. Okay, so pricing. Here's one of the other things that I wanted to do to solve this problem is I knew it had to be affordable, not absurd, because you can have the greatest thing. And if you're only servicing 10% of the profession, how does that really help the profession? It doesn't. I'd rather serve all of them. So I knew I needed to make it affordable. So here are our prices. If it's a small office, 1 to 3 workforce, it's $225. These are all per year, not per month. So please keep that in mind. Most charge services are actually like this much per month. It's absurd. But anyway, $225 is most chiropractors fall within these two practices, and then some are up in this medium range, which is $650 per year. But this entails or includes everything. It includes, managing your workforce list. The HIPAA staff training docs, it's in there. It's in the software. In fact, HIPAA staff training has to be custom to your office. So to be custom to your office, it has to have your office's policies and procedures. That's in there. We do your HIPAA policies and procedures. You manage those documents in HIPAAmate. The staff training is in HIPAAmate. So these are the areas where you can save money elsewhere, because you don't want to be doing like generic training videos and spending $25 a person to go sit at those things and you get a fancy certificate. It's not compliant anyway, because it's not custom to your office. So training's in there, the risk analysis is in there, managing your business associates is in there, workforce, EPHI inventory, blah, blah, blah. It's all there. We do have one last piece that's coming. Remember the risk management plan? That was the last little piece. So we get you through the risk analysis right now. Then in about 2 months, I'm going to say that, it's coming out where it's a huge component. It's going to be fantastic, but it's where we take all of the things that you don't have implemented, and then we walk you through the process of remember the whole, do you want to add encryption, yes or no, to this laptop? And we'll help guide you through that entire process. So that, again, my whole thing is I do not want you thinking about HIPAA. I don't want you trying to figure out HIPAA. I want you to think about HIPAA, but I don't want you to try to figure it out. Please don't do that. I spent 9 months researching this thing, almost full time. I know how to do it. You don't need to, please. It's a waste of time for you to really try to do it. Just answer the questions, walk through the software. We'll tell you when you need to do things. We'll send you reminders when you need to do them again, because a lot of the stuff is annual. But anyway, here's the prices. A workforce, by the way, is not business associates. These are just your employees. Or maybe like if a spouse comes into the office, not technically an employee, but someone who's in the office, who is under your direct control within the office, what they're doing is under your control, even though they're not paid. Don't think IRS. People get that confused too. Workforce is not an IRS person. So it's okay to have a spouse or somebody listed here, but that doesn't mean that they're like a W-2 person. So yeah, workforce members are people who work in your office. Any other questions?
We do. Dr. Senslow has another question. Do you need to pay a separate amount if someone has a satellite location?
Oh, good question. Yes. So the good news is there actually is a discount of, I think like 20% through Cal Chiro. So that's like a really nice discount. So by the way, these prices take 20% off. You have to go through a link through the Cal Chiro website. But yes, you do. This is actually per location right here. The reason for that, HIPAA compliance is extremely location driven, meaning your policies and procedures for 2 different office locations, it's impossible for them to be the same. Certain pieces can be the same because it's the same like business corporate entity, but like for example, the physical security policy, it's totally different because it's a different location. Your risk analysis actually is a very different entity because you have 2 locations. You might have different workforce, 2 different environments, even from a workforce standpoint. You have different equipment in both offices. You have different environment. One could be in just to beat a dead horse, right? One could be in a high crime area and one could not be. So it's very, very, very separate. The cool thing is though, is again, that this entire process of going through HIPAA for the first time, it doesn't take long. It takes maybe, if you're a little office like this, by 2.5 hours. If you're a little bit bigger office, because you have more equipment, for the most part, it might take you 3.5 hours. That's total. And don't do it all at once, right? Spend half hour here and there, get it done. And again, we'll remind you when things have to happen in the future. But yeah, so Doc, sorry to answer your question. Yes, you do need 2 different plans for each office. And if one person works in both offices, so let's say You're the doctor, you have 3 people in one, or sorry, 2 employees at one office, and you rotate back and forth. And you have another location, and with like 5 employees, and you're there also. You have to count yourself twice. That's how that works. Because again, it's a different environment. Any other questions?
I think that's all I have in the chat right now.
Perfect.
I did notice we have quite a few people who just called in for the webinar. So if you can please email myself, kcarey@calcairo.org, with your name so I can know who attended, because I have quite a few callers and there's a few people that I have private messages asking for names. So if you could send those back. But we did get a couple more questions.
Sure.
I'm just, because Dr. Sensler asked a follow-up, so I'll go there, and then Dr. Haywish asked one. So do IC and renters count as a workforce?
I'm sorry, independent contractor and renters?
Yes.
Okay. All right, Doc. So this is it can be a little. I will try to be concise with my answer, and I hope you're gonna understand what I'm saying. Okay. Let's use. Actually, can you ask him or her to say, is that independent contractor or renter a massage therapist or like another provider, or just a candle maker? And there's a reason I'm asking. Long story, or not long story, but so in a nutshell, an independent contractor is not part of your workforce, correct? That is correct. So they are not your responsibility from a HIPAA compliance standpoint, meaning you don't have to do their HIPAA training. You don't have to have them on your workforce. You don't have to inventory like their computer that they have, but they could be a business associate. So that's where it's a little more tricky, because you have to figure out, are they a business associate, or are they just somebody renting space and they just happen to be in my office? Let's look at those 2 scenarios. We'll use a massage therapist in this example. Let's pretend the massage therapist is an independent contractor, okay? And you may see the same patient, right? But it's your patient. The person needs a massage. You are sort of, quote unquote, you're referring them to the massage therapist, who just happens to be in your office. The massage therapist sees the patient. The massage therapist takes their own payment. There's no billing through you or any of that kind of stuff. That is a 100% separate business entity. They're not a business associate at all. They're not a workforce or not a business associate. However, they're in your office, and there's probably a good potential that they have incidental like exposure to your information, and et cetera. In that case, all you want is a confidentiality agreement, but nothing HIPAA related. Okay. Now let's take it a little step different. Let's say that the massage therapist, let's see here. Oh, let's say that you bill for the massage. It's an independent contractor still, right? Separate business, but you take payment from the patient. Okay, because you have the front desk staff. They're like part of their rent. They're paying you for your staff to do scheduling and stuff. That's actually still not any HIPAA thing, because they're not a covered entity. All right. They're paying you rent, and part of that service is money changing hands, but technically the money's still going into it's their money. Now, if on the other hand, that massage therapist is independent, but you send a patient to them, they massage the patient, and then your office bills for that patient, they collect money from the patient, or they bill insurance to cover the visit, that now becomes a business associate. That massage therapist is your business associate, because they are now performing a service on your behalf that uses patient information. Okay. I hope that explains it. It can get a little hairy. You can always shoot me an email. I'll put up my my email. Actually, here, let me just go back into that slide. I'll put my email here so you can see it again, wherever it is. I don't know, somewhere I have it. No. Shoot me an email. I can explain it to you more so, but there we go. But that's that answer. So if somebody's just renting your office, they have no access to your information, and they're not performing a service for you that involves information, then they're nothing. If they rent space but they're still performing a service for your patients or your business, then they're a business associate. Okay. And then someone else had a question too, I believe.
Yes. If I sell the practice, is it transferable?
Oh, yeah. There wouldn't be any problem with that. In fact, that would probably enhance the price of your practice because you already have a HIPAA program in place. But yeah, all we need to do on our end is just change out, like once it actually happens, say, okay, who's the new account holder? And really all we need to do is just swap out the email address of the account holder, and then that changes sort of the access to that new individual. Yeah, piece of cake. Yeah, because HIPAA compliance really should, or actually a compliance program should be, it transfers with, it's sort of like it's like owned, if you will, in my opinion, by the practice itself. HIPAA documentation, by the way, is something that you want to keep for 6 years is the rule. So if you sell a practice, you would want to be providing that office with, your HIPAA documentation. Now, granted, don't get me wrong. Remember, everyone's in the same boat here. Most people don't have anything. So starting somewhere is better than starting, just not starting at all. But yeah.
Okay, I'm not seeing any other questions come through right now, but you do have Dr. Brown's contact information there. You can email him at contact@HIPAAmate.com. If you are looking to find the link that's provided to sign up for HIPAAmate, it's under on the CalChiro website under membership benefits. So look there and look for HIPAAmate, and it'll go directly to there. And then thank you again for everyone attending today. Dr. Brown, thank you for presenting, and have a wonderful day.
Welcome. Thank you. You're welcome. Have a great day, everybody.